How to improve bladder health with exercise. Improving bladder health through exercise is all about strengthening the muscles that support your bladder and help control urination. The main focus is on the pelvic floor muscles, which act like a hammock supporting your bladder, urethra, and other pelvic organs. When these muscles are strong, they respond better to pressure increases from coughing, sneezing, or lifting, reducing the chances of leakage. One of the most effective ways to do this is through pelvic floor muscle training, often called pelvic floor exercises or Kegel exercises. These involve repeatedly contracting and relaxing the muscles at the base of your pelvis. Regular practice can significantly improve bladder control and reduce symptoms like urinary leakage or urgency. Studies show that pelvic floor muscle training can help women with stress urinary incontinence and improve overall quality of life, with about 29 to 59% of people experiencing symptom relief. Both women and men can benefit from these exercises. Men, especially after prostate surgery or with age-related muscle weakening, find Kegel exercises helpful for regaining bladder control. To do Kegels correctly, try to identify the right muscles by stopping urine flow midstream. This is just a test, not something to do regularly. Once you know which muscles to target, practice tightening and holding them for a few seconds, then relaxing. Doing this several times a day helps strengthen the muscles over time. Consulting a healthcare professional can ensure you're doing Kegels properly and that they are suitable for your specific needs. In addition to targeted exercises, engaging in low-impact activities like yoga or modified lumbo-pelvic exercises can also support bladder health. These programs often include pelvic floor engagement and have been shown to reduce urinary incontinence episodes by about 65% over 12 weeks in older women. These exercises improve not only pelvic muscle strength but also abdominal muscle activity and overall physical conditioning, all without putting excessive pressure on the bladder. Consistency is key, so sticking to a routine with supervised sessions and home practice maximizes benefits. It's important to avoid high-impact exercises like running or jumping if you experience bladder control issues. These activities can increase pressure on the pelvic floor and potentially worsen symptoms. Instead, choose gentle, supportive exercises that help strengthen your muscles without causing strain. Exercise also offers additional benefits for bladder health by reducing body fat and visceral fat, which are linked to increased pressure on the bladder and pelvic floor. Improving overall fitness supports better muscle function, lung capacity, and may help lessen urgency symptoms. Physical activity also boosts mental health and overall well-being, which can be affected by bladder problems. Before starting any new exercise routine, especially if you have a history of bladder issues or bladder cancer, it's essential to consult with healthcare providers such as urologists, gynecologists, or pelvic floor physical therapists. They can create a personalized plan that considers your health status and specific needs. For bladder cancer survivors, exercise can be part of managing side effects and improving pelvic muscle function, but it should be carefully integrated into your overall treatment and recovery plan. Remember, everyone's experience is different, and professional guidance ensures you exercise safely and effectively. In summary, strengthening your pelvic floor muscles through targeted exercises like Kegels and low-impact activities can make a big difference in bladder control and quality of life. Avoiding high-impact activities that strain the pelvic floor is wise if you have bladder symptoms. Always seek personalized advice from healthcare professionals to find the best approach for your unique situation.